Hey, if you are suffering from back pain or chronic back pain, and especially if you've got sciatica and you've been told you need surgery, I really want you to read this article I just wrote, because I talk about I give you a lot of information about making sure you've exhausted all of your options before you consider surgery, because there's a lot of risks for surgery and it's not as successful as you think. My name's Dr. Carrie Jose. I'm a back pain specialist here in downtown Portsmouth, New Hampshire. And I help people get rid of back pain naturally and on their own, even if they've tried everything, and especially if they've had it for a long time. So here's a couple things that I want you to know. So there's lots of great, what I call non-invasive treatment options when it comes to back pain. They include everything from chiropractic treatment, physical therapy, acupuncture, shockwave therapy, massage, you name it. There's a lot of really great solutions out there to help you decrease your pain. The problem is, depending on the type of back pain you have, is that you may not be trying them in the right order or with a correct strategy. When you've got back pain, especially if you've had it for a while, and especially if you've got sciatica, there's a really specific way to go about it. And the thing is, passive modalities sort of used in kind of random order, or the other problem I see is people do too many things all at once, isn't really going to work. And the other thing that you need to know is, when it comes to physical therapy, there's regular general physical therapists, and then there's specialist physical therapists. A lot of people don't realize that. They think they're all the same, and that's not true. I happen to be a back pain specialist, but here's the thing, I wasn't for the first 10 years of my career. And I have to tell you, I didn't do as good a job helping people with back pain back then. So it's really important that you go to someone who's a specialist, because they're going to have the right strategy and understand how to diagnose you properly. So if you haven't tried that, you really want to make sure you do before you jump into surgery. Because here's the thing about surgery. It is good at helping you with your pain if it goes well and you don't have any complications. However, the pain relief doesn't last. People get that confused. They think it's a pain, they think it's going to eliminate your pain, when it really just reduces your pain. And if you don't do the right things, it's going to come back. In fact, 20 to 40% of the time it does come back in about 5 years, and people don't realize that. And then what happens is you might go in for a second surgery or a revision, and the more surgeries you have, the less successful they are. As you get a second or even third back surgery, your success rate drops to about 5 to 15%. So these are things that you aren't always told before you go in for back surgery. Even minor procedures, this can happen too. So again, if you need surgery, it's important and it works. But for back pain, and particularly 80% of the time, it can be resolved without surgery and even without procedures. So it's really important that you talk to the right people, make sure you've exhausted all the right treatment, especially specialist treatment, before you go in for a surgery. I hope this helped. Check out the article I just wrote about this topic, and talk soon. Bye.